Over time and through studies, it has been realized that not all fevers that are caused by malaria, and that certain fevers are also caused by other diseases that closely resemble malaria. And therefore, to pick malaria cases, there is need to test every case of suspected malaria.
From the last 10 years, if I may give you the history of malaria in Coast, we were at around 40% prevalence of malaria in the whole of Coast region. And currently we are at less than 4%. So that considerable change of prevalence has not been accompanied by the change of behavior of both the providers and the population, in that they still believe that any fever that they're having is malaria.
The private sector, where the bulk of the population goes, did not have the RDTs, they did not have the diagnostic tests. So any patient who goes with signs and symptoms of malaria and requests for anti-malarial drugs, he or she is given the drug without being tested. So that was compromising the quality. So PSI, together with the Malaria Control Unit, came up with this program, and they decided that we could pilot a program to see how best it can function to make the RDTs accessible, and at the same time monitor the quality of service that is being offered to our clients. We are taking them through a 3-day training. Each day comprises of different aspects of the malaria case management training. The first day is actually looking at the overview, whereby we elaborate of how the picture of malaria is, what the burden of malaria is, how the endemicity of malaria is. We outline the different endemic and non-endemic areas of the country. We actually show where the prevalence is high and where it's low. And then we also show the social and economic implications of malaria on families. Then in the second day, we take them through the laboratory diagnosis. We show them how the microscope slides look like. We present the pictures. We actually also take them through the RDT testing, the rapid diagnostic testing. We show them how the positive looks like, how the negative looks like, how an invalid test looks like, so that they can recognize how it's done. And then the rest of the part of the day is actually looking at the practicum bit of it, because that is what they are going to practice in the institutions. So they have to practice, and we try to dedicate a lot of time to the practicum so that they can test each other and get the hang of it.
Then in the third day, it's all about the pharmacy and pharmacological issues, whereby you have taught about pharmacovigilance of the drugs that we'll be using for the treatment, and also about how to report M&D and how now to order for these commodities in case the commodities you're having end before even the period that you are allocated.
Before this training, when patients used to come to me with fevers, I used to give them paracetamols, I reassure them, and then I give them antimalarials before testing.
Many a times when there's no electricity, there was no other option. It was either a blood slide for microscopy or to give antimalarials for every fever that would come in.
The training was very helpful to me because I'm able now to treat the patient better than I used to do before.
It has really driven me from the cocoon of the old style of treating malaria.
The training was helpful to me because first it has given me good knowledge which I was not aware of, and from now hence I'll manage my patients well with malaria, all the malaria cases. I make sure I won't miss the diagnosis, and I will treat them promptly as per the guidelines.
It was clearly demonstrated on how to use the RDTs, how to interpret the results, and how to issue the results to the patients, and how to prescribe antimalarials.
when I go back to my outlet, what I'll do different is that all patients who come with fever, I'll ensure that they are tested for malaria before I give them antimalarials.
Mafundisho ya RDT yanasaidia sana.
I have learned that it's always good to test for malaria before treating, especially with RDTs.
The content of RDT was good. I rate it highly because we've learned a lot.